Larynx is also called as the voice box or organ of phonation. The functions of larynx are: it protects the lower respiratory tract, it helps in phonation and respiration and deglutition. We have already seen in the previous videos the cartilages of larynx. Larynx is formed by 3 paired and 3 unpaired cartilages. Today we will see the cavity of larynx. Cavity shows 3 folds: the aryepiglottic fold, the vestibular fold and the vocal fold. So what are aryepiglottic folds? These are the boundaries of the laryngeal inlet. This laryngeal inlet is bounded by the epiglottis above, which is shown in this adjoining diagram, the aryepiglottic folds on either side and the interarytenoid mucous fold behind. What are the muscles controlling this laryngeal inlet? The closure of the inlet is helped by oblique arytenoid muscle and the aryepiglotticus muscle. The aryepiglotticus lies within this aryepiglottic fold. The opening of the inlet is helped by thyroepiglotticus muscle. The cavity is divided into 3 parts: the supraglottic part or the vestibule of larynx, the infraglottic part and the glottic part, the middle part which lies between the vestibular folds and the vocal folds. Now what are vestibular folds? We will describe them under the following headings. These are the folds which are covered by ciliated columnar epithelium. They lie above the vocal folds. Beneath the epithelium is the submucosal connective tissue, underlying which is the vestibular ligament, which is formed by the lower free margin of quadrate membrane. The space between the 2 vestibular folds is called Rima vestibuli, and the function is it allows inspiration. So it prevents the air to go outside during expiration, and hence it is called exit valve. So it helps to hold the breath at the end of inspiration. Hence it is called exit valve. How to describe the vocal folds? Again, the definition, the lining, the contents and the functions. The vocal folds are specialized folds that help in production of voice. The extent is from the tip of the vocal process of arytenoid to the posterior surface of the thyroid cartilage. It is directed upwards. The Rima glottis is said to be the antero-posterior cleft between the 2 vocal folds. Now, if you are asked short note on Rima glottidis, you will describe it under the following heads. What is the definition? It is an antero-posterior cleft or a space between the 2 vocal folds and medial surface of arytenoids, which makes this space a pentagonal in shape. So anteriorly between the 2 vocal folds is the triangle, and between the 2 arytenoids is the rectangle, so pentagonal. The boundaries: in front is angle of thyroid cartilage, behind is interarytenoid space or the fold of mucous membrane, on each side are the vocal folds. The length in males is 23 mm, in females is 17 mm. So it is divided into intermembranous part which is triangular, which forms anterior 3/5, and the intercartilaginous part which forms the posterior 2/5. The shapes of the Rima glottis will be next to write in the short note. In quiet respiration, it is pentagonal in shape. In forced inspiration, the 2 arytenoids are moving laterally, so it becomes a diamond shaped. In normal phonation, there is adduction of the vocal cords, so it becomes a inverted funnel like in shape. and in whispering it becomes a very narrow chink. The structure of the vocal cords, it is lined by stratified squamous non-keratinized epithelium as against the vestibular fold. Peculiarity is it has no submucosa, it has no mucous glands. Therefore, they appear pearly white in color, and the contents are it contains vocal ligament and vocalis muscle. The function is expiration or they vibrate during phonation. What are the muscles of the larynx? There are intrinsic muscles and extrinsic. The intrinsic muscles are cricothyroid, posterior cricoarytenoid, lateral cricoarytenoid, transverse arytenoid, oblique arytenoid, thyroarytenoid and its thyroepiglottic component. Now the cricothyroid muscle, it arises from the cricoid and goes to the inferior margin of the thyroid cartilage. The posterior cricoarytenoid, which is seen here, arises from the posterior broad lamina of cricoid and is inserted on the posterior surface of the muscular process of the arytenoid. The lateral cricoarytenoid arises from the upper margin of the cricoid. It lies on the inner aspect and it is attached to the anterior surface of the muscular process of the arytenoid. The transverse arytenoid is one unpaired muscle of the larynx extending between the two arytenoid cartilages. Extending from muscular process to the apex on either side are the oblique arytenoid muscles. These continue upwards to form the aryepiglotticus muscle. The thyroarytenoid is a small muscle which arises on the posterior aspect of thyroid cartilage and goes to the arytenoid behind. A part of it is called the thyroepiglotticus muscle. The movements of vocal cords are adduction, bringing the cords together, abduction, tension of the vocal cords, which is usually done during phonation, and relaxation. Now the adductors of the vocal cords are lateral cricoarytenoid, this muscle, and the transverse arytenoid. Because of their attachments, they will pull these muscular process will go like this, because of which the vocal cords will come together. When the muscular process moves laterally, the vocal cords come medially. The transverse arytenoid will bring the two arytenoids closer so that the vocal cords are adducted. Abductor of the vocal cord is one muscle that is posterior cricoarytenoid. Because it is attached to the posterior surface, it will move the arytenoid muscular process medially so that this vocal process will move laterally and there will be abduction of the vocal cords. Therefore, this muscle is called the safety muscle of larynx because it helps in opening this vocal or Rima glottis and allowing inspiration. The muscles increasing the length and tension of vocal cord is the cricothyroid because it increases the distance. When this cricothyroid will contract, either the thyroid will move in front or this it will pull the arytenoid backwards, and because of this there is an increase in the length or tension of the vocal cord. Muscles decreasing the length and tension is the thyroarytenoid and vocalis muscle. If you are asked short note on the vocal cord, you should also include its blood supply, which is by superior inferior laryngeal arteries, and the veins follow the arteries. The lymph nodes, which go to deep cervical and pre-laryngeal group of nodes. Nerve supply of vocal cords is by both internal laryngeal and recurrent laryngeal nerves, branches of the vagus nerve. Coming to the muscles, as we said, we have seen intrinsic muscles which move the vocal cords. What are the extrinsic muscles which move the entire larynx? These are mainly the elevators of the larynx and the depressors. Elevators are the suprahyoid muscle. Here in this diagram you can see this is digastric muscle. Then there is a stylohyoid muscle. This is the oral diaphragm mylohyoid muscle, and another muscle is geniohyoid. The depressors are the infrahyoid muscles, which are the sternohyoid muscle, the sternothyroid, the thyrohyoid, and the omohyoid muscles. The longitudinal muscles of pharynx are the stylopharyngeus, salpingopharyngeus, and palatopharyngeus muscle. All these muscles move the entire larynx. This is a table just showing the muscles, intrinsic muscles and their action, which we have already seen. Now to remember the blood supply and the nerve supply of larynx, this is a chart which shows the blood supply. It is different above the vocal folds and below the vocal folds. So the vocal folds are called the watershed line of the larynx. The blood supply above is by superior laryngeal artery, below is by inferior laryngeal artery. The veins correspond to the arteries. The sensory nerve supply above the folds is by internal laryngeal nerve, below is by recurrent laryngeal nerve. Motor supply, all the muscles are supplied by the recurrent laryngeal nerve except cricothyroid, which is supplied by the external laryngeal nerve. Also here you should remember the transverse arytenoid is supplied by recurrent as well as internal laryngeal nerve. So transverse has two peculiarities. It is an unpaired muscle and it is having double nerve supply. Secretomotor fibers coming from the recurrent laryngeal nerve. Lymphatic drainage above go to the pre-laryngeal group, jugulo-digastric nodes, and below go to pre and paratracheal group of lymph nodes. This is in detail the nerve supply. We have already seen this. So the superior laryngeal nerve, which is a branch of vagus, gives internal and external laryngeal branches. The external laryngeal is both motor and sensory, motor giving to the cricothyroid muscle. The recurrent is also a branch of vagus. It gives motor to all the muscles and sensory to the area below the glottis. Coming to the blood supply, so the upper part is supplied by superior laryngeal. It is a branch of superior thyroid, a branch of external carotid. The lower part is supplied by inferior laryngeal, branch of inferior thyroid, a branch of thyrocervical trunk of subclavian artery. Here you can see the branches, the thyrocervical trunk and giving the inferior thyroid, which will give the inferior laryngeal artery, which is going here, and the external carotid is here, which is giving the superior laryngeal artery. The venous drainage, above it goes to the internal jugular vein, whereas below it goes to the, so this is the internal jugular, whereas below it will go into the subclavian vein. The lymphatic drainage we have already seen. There is one peculiarity that the vocal folds are relatively devoid of lymphatics. That is why it is said that when there is a cancer of vocal cords, it is detected very late because there is little lymphatic spread. A Delphian node is a midline pre-laryngeal lymph node near the thyroid, which indicates metastasis from thyroid or from cancer of the larynx. Function of larynx is phonation. Now phonation occurs when the expired air, bout of air, will vibrate the vocal cords, and there are also other vibrators. There are resonators like the paranasal sinuses, which help add to the resonance of the voice, and articulators like our teeth, the lips. Now applied anatomy, pubophonia, as we know, is a change in voice at puberty. Also in old age, due to the changes in larynx, voice changes. The safety muscle is the posterior cricoarytenoid. Due to excessive use of the voice, there may be a nodule on the vocal folds, and this is called as teacher's nodule or singer's nodule. Laryngitis is the infection and inflammation of larynx. The pain of the larynx is often referred to the ear because of the common nerve supply. Laryngeal edema is very dangerous because it will affect respiration, and this occurs usually in anaphylactic shock. Foreign bodies in the larynx can be removed by Heimlich's maneuver, wherein you could put a strong pressure in the upper part of the abdominal cavity so that if anything is stuck in the larynx, it can come out with that blow. Goalies in ice hockey, they use protective guards to prevent the cartilages of larynx from fracture. Then café coronary is a phenomenon when an intoxicated person suddenly dies. It is actually due to a bolus going into larynx because he is intoxicated, but it appears as an heart attack. Laryngotomy is an emergency procedure when the larynx is opened to maintain the airway and the breathing. So in emergency conditions, we should remember ABC, that is, you have to first maintain the airway. When you are doing any surgery in the larynx or in that area, precaution should be taken to avoid injury to the laryngeal nerves, especially during thyroid surgeries. If there is damage to external laryngeal nerve, there is paralysis of cricothyroid, tensor of vocal cords, so the patient is unable to speak loudly or shout. If left recurrent laryngeal is affected, it is usually due to mediastinal syndrome because the left recurrent laryngeal lies in thorax. It winds around the aorta to come in the neck, whereas right recurrent lies in the neck. Injury to the recurrent laryngeal nerve, unilateral, it leads to paralysis of all muscles except cricothyroid because it has a different nerve supply. The vocal cords lie in paramedian position. The speech is not affected due to unilateral injury because the other cord compensates. Injury to bilateral nerves, both cords remain in the paramedian position. There is difficulty in breathing and speech is not possible. Injury to both external and recurrent laryngeal nerves, the cords remain in cadaveric position due to total paralysis, abducted and fixed. Voice production is not possible. If there is only injury to internal laryngeal nerve, there is sensory loss, but this is dangerous because foreign bodies can then easily enter. If there is normal sensation, they will not allow foreign body to enter, because if something goes in the larynx, there is a sudden bout of cough as a protective phenomenon. What is Siemens' law? In chronic paralysis of these affection of these nerves, if it is over a long period of time due to the slow damage to the recurrent laryngeal nerve by a slowly growing tumor, the abductors are affected first. And why this is so? It is because they are having thickly myelinated nerve fibers supplying the abductors. These thickly myelinated fibers are more vulnerable to oxygen lack. Laryngeal carcinoma is very common. It accounts to 25% of all head neck cancers. It is in later ages of life. Most common is that affecting the vocal cords, but it is because it is affecting the voice, it is diagnosed earlier. Hoarseness is the common symptom that the patient complains. Other symptoms are dysphagia, hemoptysis, throat pain, ear pain, airway compromise, aspiration, and a mass in the neck. If you are asked a short note on vocal cords, you have to just write the definition of vocal cords, the structure of vocal cords, the movements of vocal cords in normal phonation and during speech, and you should mention the blood supply, nerve supply of vocal cords, lymphatic drainage, and applied anatomy of vocal cords only. So for applied anatomy of vocal cords, this much is sufficient. Thank you.